What are RWJUH's best practices with regard to clinical pathways?
Clinical pathways is I've heard that used as a buzzword around the healthcare industry that should solve everything. We should have no uninsured patients. Everything should be perfect if we use clinical pathways. And I'm a big believer in standardization and protocols and pathways and taking variability out of what we do in healthcare. And so we do use them. We have protocols for different diagnoses. However, I think the critical factor for protocols and pathways is that they have to be matched with the other aspects of healthcare, which is evidence-based practice and technologies that makes it easy to use the protocol and to track the use of the protocol. And so we're probably not as far along with the use of clinical pathways as we should be, because some of those things haven't caught up in regard. And so in the cases where we can package all three together, it's incredibly successful. But I think you really need to know so that it's not name only, so that you're not doing it just in name that you have a clinical pathway, but that you really actually can accomplish something. You have to have the evidence-based information. We see changes in healthcare where what was the proper thing to do 5-10 years ago is not the proper thing to do. So we have to make sure we understand the science behind healthcare delivery, and then we have to make sure that we have a system that makes it easy to do that, and then the ability to track it. Because if you're going to change my performance, I'm not going to be perfect the first time I start doing it. So you're going to have to give me feedback on, hey Josh, you were 80% with this. But that means you have to know that I was 80% with it, and you can't have 20 people following along to make sure that I did it. It has to be automated. So I think we're moving into that realm, but I think it's critical that the technology is there as well.
RWJUH is known for offering its patients the latest advancements in surgical technology. Please describe the value that the hospital has experienced from this commitment, both from a quality of care and cost efficiency standpoint.
Sure. Changes in technology are a great, they're great for patients. And I think that's why we've pursued all the advanced surgical technologies we use, like the Da Vinci robotic system, minimally invasive heart surgery, and many other techniques. The great news for patients is that most of these advanced surgical techniques result in quicker recovery times, less time in the hospital, less pain after surgical procedures. And so first and foremost, that's why we're doing it, is it's good for patient care. From a financial perspective, for the hospital, the critical element for those is that they decrease the use of the hospital time. And so it's important that the outcomes are usually better the less time one spends in the hospital. So really from a financial perspective, actually from a patient and a financial perspective, it's the same benefit. Better outcomes for the patient lead to lower costs for the hospital.